Dr. Kevin Kavanagh. Hey, good morning. How are you?
Good morning, Jack. I'm doing quite well.
Dr. Kavanagh is a retired physician, also the founder of Health Watch USA. And, well, we've got a lot to talk about this morning. Where do we start? I tell you where I'd like to start is because my wife and I have been talking about it all week with all the protesting that's been going on with thousands of people, some of which are wearing masks, others aren't. Is this going to just set the coronavirus deal back?
Well, it's not going to help it, Jack. That's the big concern I have. I'm hoping with the warm weather that this is being done outside, that we may not see as big of a spike as what I'm fearful that we may see. But so far, we're not seeing a huge spike nationwide for Memorial Day. Unfortunately, in Kentucky, there does appear to be some uptick in cases. So in Kentucky, we really do need to be wearing masks when out in public and social distancing.
Tell us what the WHO has now recommended in terms of masks.
Well, the WHO has come around to saying that the public should be wearing masks. For example, a cloth mask that's 3-ply that you've made according to a recommended pattern, and that this mask will help to prevent asymptomatic spread. That type of mask is not designed to protect you from getting the virus, but is designed to help an asymptomatic carrier who doesn't know they have the virus from spreading it to others. But the big thing is that if you're 60 years of age or older or high risk, they're recommending wearing an N95 mask. Now that will be a little bit controversial. It's not that N95 masks aren't the best to stop a virus. It's that will a mask alone be enough to stop the virus if you don't have on goggles, you don't have on a full gown and gear that, for example, a healthcare worker has. And the fear would be that if you wear an N95 mask, yes, that's going to help some on preventing you from getting the virus, but not enough that you need to not do proper social distancing. So if you have someone that's coughing or sneezing, or you want to get up close to somebody and you're out in public and you have an N95 mask, that probably isn't a good idea.
Talk about this antibody rate a little different than they had expected.
Yeah, that's concerning. California redid the test. This was a month after the initial reports that was, well, this is very low. It's just like the flu. Again, it's not the flu. You can look at the makeshift morgues and the mass graves in some countries are having to know that. And they redid the test, and the antibodies now are approximately half the level in the general population that the previous test showed. And that is very concerning. Likewise, Sweden has surveyed their population the end of April, and that showed only an antibody rate for immunity in their population of 7.3%. Again, that was much lower than expected. So the big take-home message here is we're not sure what's going on, but let's not rely on the narrative of let everybody get the infection and we'll be immune. Remember, this is a coronavirus. That may not happen, especially in those people that never knew they had the infection. They may not have had a severe enough infection to mount enough of an antibody response to really keep them immune for any period of time afterwards. So it is a little bit concerning. So the big message here is continue to follow guidance, wear masks in public, and social distance. The good news is that a number of modeling studies have shown that one, this helps to prevent spread of the virus, and that in itself, it may result in even a burnout of the epidemic. So now that we're seeing people social distancing, they're wearing masks, they're more outdoors, it's becoming summertime, maybe this epidemic will tend to burn out, and hopefully we'll be prepared for a second wave and prepared in a way that if it does come, we can just snuff it right out.
Always good to talk to you, Dr. Kevin Kavanagh. Thank you so much for being with us.
Jack, thank you very much, sir.
You know, we talked about this, Holly, a few weeks ago. That there was a story about mask shaming. Do you remember that?
I do.
And I thought it sounded far fetched. People aren't going to do that. I witnessed it.
Really?
Yeah, I was at a restaurant by myself, having dinner, and they were taking all the precautions, by the way, and everybody was separated and so on. But a few tables down from where I was sitting, there was a guy who, I heard him make the comment to a person sitting at another table that apparently he didn't even know. And the person sitting at the other table was wearing a mask, and I heard him say, "Does that make you feel better?" And the person said, "What do you mean?" "That mask, does that make you feel better? Because you know it doesn't do any good." Yeah.
I think I would have said, "I'm hoping it makes you feel better,
Right.
sir."
Yeah. If I had been able to work up a good sneeze at that point, I would have just walked by his table. Sorry.
Excuse me.
Oh, excuse me. I'm
Gosh,
sorry.
I forgot to put my mask back on.
Exactly, yeah. Hope you don't get the virus.